Shabbat Shalom. There's no question that in Judaism, we honor those who care for other individuals as individuals who walk in God's ways, and we celebrate those involved in all aspects of caring for others' health, in particular, as engaged in truly sacred work. I'm reminded of the story of a certain Dr. Goldstein who moved into the neighborhood and began attending the local shul. The synagogue's rabbi, Rabbi Feldman, was delighted, and it wasn't long before they were helping each other in their work. Rabbi Feldman referring people to the doctor, and Dr. Goldstein telling patients about the shul. It was about a year into this new relationship. The rabbi noticed several of Dr. Goldstein's patients calling the synagogue office to ask for written copies of the rabbi's last 4 Shabbat sermons. Rabbi Feldman was most pleased with this interest until he discovered that the doctor was seeking to heal his patient's bouts with insomnia. Yes, rabbis and anesthesiologists have a lot in common. We put people to sleep for a living. All kidding aside, as we begin to wrap our heads around the first anniversary of the pandemic sweeping our society, there are so many to whom we owe our thanks for not only keeping our world turning, but for putting their own lives on the line for our well-being. Indeed, in these trying times, we've been reminded that a hero can be anyone willing to put their own life on the line and to rush toward the suffering rather than away from it. This includes not just the healthcare heroes whom we honor today, but also the many people who perform tasks that enable our society to function. The janitors and the maintenance staff in hospitals, for example, along with the workers in drugstores and supermarkets, postal workers and delivery truck drivers, pharmacists, military personnel and teachers, police officers and firefighters. On behalf of the congregation, I want to say thank you to all our essential workers and first responders for what you have done and continue to do during these difficult times. We use this Shabbat as an opportunity to single out for special gratitude our healthcare professionals in whatever capacity that they serve: doctors, nurses, dentists, dental hygienists, scientists, psychologists, psychiatrists, social workers, staff at nursing homes and senior living facilities, all those who work in hospitals and medical offices of all kinds, and all who fall into the category of healthcare heroes. The Torah demands that we do not stand by idly while our neighbor bleeds. The Torah further demands that we love our neighbors as ourselves. In normal times, healthcare heroes allow us to fulfill these mitzvot of obligation to others. In normal times, healthcare heroes help each of us to honor God's mandate that we choose life for ourselves by taking the necessary steps to remain healthy. In normal times, healthcare heroes lengthen life and strengthen life every single day. These are anything but normal times. And in this last year, each of us has been called upon to elevate for the greater good, despite very difficult circumstances. There is no comparing of tragedies, but we can learn much from others who similarly confronted suffering. In the mid-20th century, the leading rabbi of modern Orthodox Judaism, Rav Joseph Soloveitchik, sought to derive lessons after the Holocaust. A person is obligated, he wrote, to resolve not the question of the causal or teleological explanation of suffering, Rabbi Soloveitchik told us, but rather the rectification of suffering in all its halachic simplicity. The Rav explains, one does this by transforming fate into destiny, elevating himself from object to subject, from thing to person. In those years following the indescribable tragedy that was the Holocaust, Rav Soloveitchik reminded us to focus less on the whys of our suffering and more on the now whats. The Rav taught us that we must push past seeing ourselves as victims to exert control in the areas in which we can control. For Rav Soloveitchik, Zionism as a response to the Holocaust was one means by which we Jews could elevate ourselves from object to subject and from thing to person, and thereby to transform fate into destiny. The contemporary American milieu, however, is clearly unaware of Rav Soloveitchik's teachings. For the last many years, claiming victimhood has been among our favorite American pastimes, as governmental leaders compete with each other and we compete with our neighbors and friends over who is the most persecuted, who is the most suffering, who is the most deserving of sympathy, and who has the greatest woe is me story. In the 21st century, victimhood is our justification for selfishness, and it is our excuse for failing in our obligations to care for others. In contradistinction to this human tendency toward victimhood, our rabbis teach Ezehu Gibur, who is a hero? The answer, Hakovesh et Yitzro, the one who conquers the inner voice of self-preservation and self-service in the name of caring for others. There's no question that our healthcare workers were just as afraid of and exhausted by this virus as anyone else. But in spite of their fears and exhaustion, our healthcare heroes continued their sacred work because they had the knowledge and skills to help others. You, are our heroes, and we're grateful to you. Thank you. Most of the world, however, is neither victim nor hero. In the face of so many unknowns over this year of pandemic, most of us were and continue to be justified in our desire to stay home, to isolate, to avoid interactions with others. But a year into this, we must begin to learn to live with the virus, taking all necessary precautions, of course, including masks, distancing, and if and when you can, receiving the vaccine. We must begin slowly and prudently to venture out of our homes. We must begin again to seek community, and more importantly, to offer community, and not just on Zoom, but in our sanctuary as well. Even more, we must begin to truly take stock of how many are in need around us, and to realize how each of us can be heroes in our own way. While healthcare professionals can be heroes to so many, all most of us need is to be a hero to just a few. Just over a week ago, we read in the Megillah of Mordechai's challenge to Esther. Esther was an innocent young woman who all of a sudden found herself queen of Persia, a queen very much subservient, though, to a powerful king. Nevertheless, Mordechai begged his niece to go before Achashverosh and to plead on the Jews' behalf to the king to protect the Jews against Haman. Now, Esther became caught between her powerful husband on one side and her loving but demanding uncle on the other. Queen Esther replied to Mordechai, "All the king's courtiers and the people of the king's provinces know that if any person, man or woman, enters the king's presence in the inner court without having been summoned, there is but one law for him or her, that they be put to death. Only if the king extends the golden scepter to him may he live." "Now," cried Queen Esther, "I've not been summoned to visit the king for the last 30 days. Queen Esther was afraid to go before the king to plead on behalf of the Jewish people, to ask the king to foil Haman's evil plot to destroy our people. She wondered why she should put her own life at risk to save her community. Mordechai wrote his niece back in a letter, to which he said, "Who knows? Perhaps you have come to the kingdom for just such a time as this, and for this very occasion." I have no doubt that the hands, the hearts, and the minds of our healthcare professionals have been guided gently and lovingly by the Holy One, blessed be God. That these heroes should step up to care for us, that these possessors of sacred wisdom should arise to figure out how to beat this terrible virus, and that these instruments of the divine will should remind each of us in our own ways to overcome our sense of victimhood in the face of pandemic. Their example should inspire each of us to ask how we in our own ways can elevate ourselves, as Rav Soloveitchik teaches, from object to subject, from thing to person, and thereby to transform fate into destiny. Today we celebrate and give thanks to the healthcare heroes in our midst. And as we mark 1 year of living with this pandemic, we give thanks to all who stepped up in their own ways to care for others. We also begin to realize our own obligation to re-emerge from our shelters, prudently and cautiously, of course, to seek community in person, to offer community in person, and to care in our own ways for those who are in need. In the movies, heroes arrive on white horses, swinging ropes, invisible jets, or in souped-up automobiles. In real life, heroes arrive with beakers and test tubes, with stethoscopes, blood pressure cuffs, and other medical instruments. Heroes also arrive with food packages and gift cards, with lesson plans and blackboards, with clothing donations and with toiletry donations, with open arms and with listening ears, with wisdom, courage, and vision to uplift and to unite. Whatever they offer, heroes always arrive with the intention of putting others' needs before their own. And usually, it's simply sufficient just to arrive. Similarly, in the comic books, heroes wear capes and masks. In real life, those capes often appear as white coats, and masks, well, wearing a mask is an act of heroism that we can all perform. May we this day and every day give thanks to the healthcare heroes in our lives and in our community. And this day and every day, may we seek to overcome our own sense of victimhood in order to love our neighbors, in order not to stand idly by while our neighbor bleeds, in order to offer community to mourners and celebrants alike, and to be the hero in ways small and large that the people around us need. May God bless us all with health. May God bless us with the desire to seek and to offer in-person community. And may God bless us especially, and all the healthcare workers among us, with the knowledge that you are truly, truly appreciated, and with the pride in knowing of a job well done. And let us say together, Amen. Shabbat Shalom.
Shabbat Shalom.
And thank you.